Hi, Katie. My name's Allison. I'm calling from Canadian Mental Health Association.
Oh, hey, Allison. How are you today?
I'm good, thanks. How are you?
Good, thank you. Allison, you're the workplace outreach worker for CMHA here in Windsor-Essex. Today's Blue Monday. What have you been seeing out there lately?
So in my role, I provide one-on-one supportive counseling to a lot of frontline employees, and I work with various different workplaces and organizations in Windsor-Essex to help support the mental health of different employees in various different workplace settings. And so one of the things that, I'm noticing is that people really are struggling, especially those who are take a frontline position. And what I'm seeing is that a lot of the people who are coming forward for help tend to be people who have struggled with mental illness in the past, and those struggles are exacerbated by the pandemic.
If you have someone in your life that you want to help out or check in on, what's the best way to do that?
Any way that you can reach out to people right now is vital. Whether it be through just picking up the phone or doing video chats or just sending a quick text message.
How do these check-ins and chats, how do they actually help the person who might be struggling?
It helps to reduce the feelings of isolation. Right now, obviously with the restrictions that have been put in place, we know that for our physical health, the best thing we can do is try to only interact with people that we already live with. But our socialization, I wish they called it physical distancing, not social distancing, because I think it should be social connecting is what we should still be doing. And there's a lot of ways to do that without having to be physically in front of somebody. Because we know that when isolation is increased, mental illness increases. Any previous cognitive impairments that someone might have, when we're looking at the elderly, chances of dementia and further complications with cognitive impairment, those rise with isolation. People tend to practice more negative coping strategies when they're isolated. So things like turning to substance use or addiction. We have seen in our community since March a significant increase in the amount of people using substances, as well as the overdose rate in our community has been really high. And so we know people are turning to those negative coping strategies because it's easier to do when you're alone in your house.
Well, Allison, I know in your job, people reach out to you with their problems. How are you doing throughout all this?
I'm doing fairly well. Thank you for asking. I have a great support system in my team. Obviously, working at the Mental Health Association, everyone who's part of the team knows that mental health is vital, and so our managers and our leaders really assist us in making that a priority, not just with our clients, but with the staff as well. So I do feel well supported.
Well, I'm happy to hear that, and I'm happy that you had time to chat with me. I'm going to continue calling some people in our community to see how they're doing today, so I will leave it there, and thanks for your time.
Not a problem.